Hey everyone, good day to all. Myself Dr. Ajay Maurya. So guys, I'm going to start the all 90 subjects random PYTs for the Fmge guys. Okay now. So guys, there is why I'm going to start the randomly guys, because in the exam also guys you are not going to get the MCQs on the system one. Okay now. So all are going to the you will get the random wise. Okay now. So guys, if you're going to study the subject wise means guys you like you are going to spend the 1 hour for the one subject only. Okay now. So you have to do the random topics. Okay now. So I am going to pick up the random topics, and I'm going to create some 10 to 14 episodes, so that you will cover the you so that you will cover the all the random subject PYTs. Okay now. This is the going to the episode one. Okay. So I think you know what topics I'm going to cover as the my thumbnail says. Okay, let's begin. First one is the Glasgow Coma Scale. See this, what is the use of the GCS guys? So it is used for the assessment of the patient. Okay now. So that will what happens, like what we are going to do the further investigation or the treatment of the patient. Okay now. So guys, how to these are, see these guys, this is the we are going to assess the eye, verbal, and motor responses. Eye, verbal, and motor responses. So mnemonic is the EVM, electronic voting machine. EVM, EIV verbal, M motor. What is the highest score given for the eye? This is the 4. This is the 5 for the verbal, 6 for the motor. Okay, na? See here. This is example. See here, guys. See here. Eye response. Okay, now see if the patient is opening eyes spontaneously. Okay, okay. Then you have to give the score of 4. The patient give the sound to the so for sound. Okay, this is the 3. The patient opening his eye by giving the pain. Okay, pain. Open. 2. The patient is not opening his eyes, then you are give the 1. Okay. Next is the verbal response. Okay, now the patient is conscious and unoriented. It's okay. And give doctor, hello doctor. If I ask hello, hello doctor, conscious speaking, is the your score 4, 5. The patient confused. Hello, doc, where I am? What's my name? The confused, totally confused. 4. Words inappropriate. Okay, now like using the bad words. Okay, now inappropriate words. This is the 3. If the patient is but like if the patient is having the normal having if the patient is verbalizing sound like like this. Okay na, different sounds. Okay na, using the different sound like have you eat the food like this one. Okay, this is the abnormal sounds. Okay na, this is the 2. If the none, there is 1. Okay na. This is the patient is obese. Motor is the patient is obese. Okay, is the 6. The patient is localize the pain where I'm okay. Localize where I'm touching it is the 5. The patient is withdraws. Okay, now with that this is the normal flexion. It is the 4. If the patient has a normal flexion, it's a abnormal flexion. Abnormal flexion is 3. Abnormal extension is the 2. If the patient not responding, is the 1. See, very simple guys. Okay, now just you have to remember. Okay, now and see here how to remember this one guys. See here, see here. One confused word sounds nowhere. See here. One confused word sounds nowhere. Remember this one, okay now? So that you will get this one. And guys, just by heart this. Just by heart this. Okay, by heart this one, guys. Okay now. So guys, what is the mild score is the 13 to 15, moderate 9 to 12, severe less than 8, dead is 3. Okay. So guys, please try to solve this question. Okay now. Calculate the GCS of the patient exhibiting the eye opening on painful. See, eye opening on painful stimulus. How much? This is the 2. Confused. How much? 4. Flexion. Exhibit flexion. Normal flexion is the 4. How much? 4 to 6, 8. 4 to 6, 4. That how much? It's a 10. Okay. Yes, here. If GH is less than 7, what will do? You have to always intubate the patient first. Okay, always intubate the patient. Okay, now. Okay, now with the Glasgow Coma Scale, please remember, guys. Okay, now next one is, guys, this is the brachial plexus defects. Brachial plexus defects. Okay, now the first one is the Erb's palsy. This first one is the Erb's palsy. Okay, now first one is the Erb's palsy. See here, Erb's palsy. This is the injury to the upper trunk. Injury to the upper trunk of the brachial plexus. The nerve root is the C5, C6, C5, C6, C5, C6. What are the nerves are mainly involved here? See, except ulnar and median. Okay, na? Except ulnar and the median, all the nerves are involved. The axillary nerve, musculocutaneous nerve, suprascapular nerve, radial nerve. Okay, na? See here, for the Klumpke's palsy, guys, this is Klumpke's palsy, injury to the lower trunk, nerve root is the C8T1. Okay, na? The nerve root mainly involved is the ulnar and the median. See, Klumpke's come. Come, come, see, come. Clump is ulnar median. See, clump is come, come, come. See the ulnar and median. Okay, na? Accept this one. Rest are Erb's palsy. Okay, got it? So, okay, done. So, this is the causes are most common is the birth injury. This is the birth injury, guys. Shoulder dystocia. The shoulder dystocia. Okay, na? See, here, what are the scenarios? It is the arms are adducted. Arms are adducted. Arms are adducted medially, and elbows are extended. See here, elbows are extended. Forearm pronated. Finger is flexed. Finger is flexed. It is also called as policeman tip hand, also called as waiter's tip hand or partner's tip hand. Okay, now the next one is the term key. Ulnar median is the C8 and T1. Okay, this is a claw hand. Claw hand, complete claw hand is hyperextension at the MCP joint and is a flexion at the interphalangeal. Okay, flexion at the interphalangeal. Okay, now because see here, and also there is a because why it happens due to the lumbricals and the interosseous muscles are get paralyzed. Lumbricals and the interosseous muscles get paralyzed. Okay, now next one is the bringing of scapula. Bringing of scapula C5, C6, C7. See here, this is the due to injury to the what? What nerve? Long thoracic nerve. Long thoracic nerve. What muscle paralyzed? It is the serratus anterior muscle. It is serratus anterior muscle. What border of the scapula is mostly going to become prominent is the medial border. Okay, na? This is the medial border. Okay, na? Then see, very simple. Ulnar median. Others are Erb's palsy, C5, C6. Done. Very simple, guys. Next one is the dermatophytes. We have in the trichophyton, microsporum, epidermophyton. Okay, now see, guys. Next, see here we are in the trichophyton. This is the skin, hair, nail. The skin, hair, nail. It involves skin, hair, nails. Microsporum, it is the skin, hair, and the epidermophyton only the skin and nails. How you have to remember? See here. See, microsporum, rum, MN. Okay, now after M there is no N here. Okay, now after M there is no N here. Remember, skin, hair. Okay, now this is the phyton. Okay, now this is the epidermophyton. Fight your epidermophyton. You have to fight with the nails. So the skin and nails here. Tricho means 3. Everyone knows all 3. Microsporum M. There is M. There is no N. Okay, na? MN. See M. After that there is no N. Skin hair. Epidermophyton you have to fight with the nails. Nails. Skin is common for all. Trichophyton example is shaped pencil shaped. Microsporum spindle shape. Club shape is the epidermophyton. This is the trichophyton. This is the trichophyton pencil shaped. Microsporum is the spindle shaped. Epidermophyton is the club shape. It is the club shape, guys. Okay, you will get one MCQ. More microsporum is seen in the most Macrosporum. Okay, most macrosporum is seen in the trichophyton. Next one is this one is the CSF. This one is the CSF interpretation, guys. So, okay, now first of all, you have to know this one, guys. What is the most common cause of the meningitis in the more than 2 years children? It is the meningococcal. It is the meningococcal. Okay, now in adults it is the pneumococcal. Pneumococcal. Please remember this one first of all. Okay, now. Okay, now if it is the HIV positive, it is the cryptococcal neoformans. Okay, now. Next one, just remember here, guys. Please remember this one, guys. This is a very, very important one. This is the guys. We are having this is the pyogenic bacteria. This is the actually called TB. This is called a bacterial. This is the bacterial meningitis. That is TB meningitis. This is a viral meningitis. This is the fungal. Don't remember this one. Just remember these three guys. Okay, now see here. Please listen very carefully. This one, guys. Okay, now see here. See here, one thing is remember, please remember, this is a viral, normal, bacterial, okay, in viral, all are normal, except lymphocytes. See, viral, normal, all normal, except the L lymphocytes. See, bacteria loves to eat glucose. That's why bacteria, in bacteria meningitis, there is always less glucose. Okay, now see here, guys. When the bacterial meningitis is the see here, what about bacteria? There is if it is bacterial, it means there is a more neutrophils. Everyone knows neutrophils. What if there is high increased neutrophils? What do you mean? It is the bacterial infection. See here, the glucose is less only because bacteria loves to eat glucose. That's why there is a low glucose, and there is a more protein. Just remember the bacterial meningitis. There is a more neutrophils and the decreased glucose. Okay, na? And increase these two are mainly. Okay, na? See, bacterial tubercular, and there is a pressure increase. Okay, na? Increase in pressure. Just remember these two are defined. These are most important. See, TB here. See the TB meningitis. It is straw color. See here. TB meningitis. See here, guys. You have to differentiate between the TB versus viral. See here. See, guys, here. I told you that viral normal. All are normal. Viral color is clear. Now this is the normal, all normal except the lymphocytes. See, very easy to root out the viral. See, TB meningitis, guys. See here also, guys. The lymphocytes are more. Lymphocytes are more. Okay, now there is a glucose also decrease. TB, and also TB also called bacteria only, na? Okay. This is the see, guys. One thing you have to remember in the TB is there is a maximum increase in the protein. Maximum increase in the protein seen in the case of the TB meningitis. And also the cells are lymphocytes. So, guys, see here, due to the maximum increase in the protein, guys. That's why there is a formation of there is a more hyperproduction of protein. There is a formation of the spider-like nets. It is called the cobweb pat. That is the cobweb seen in the TB. Okay. TB, okay? Remember this one, guys. RC. Okay, now please remember once again. See, bacterial, this is the more neutrophils and decrease glucose. Okay, now TB, this is a maximum increase in the protein. Also, the lymphocytes are also seen in the TB. Okay, now please remember this, guys. Okay, now next one is the severe malnutrition. This is the SAM character. This is the SAM. Okay, now see here. Criteria is the age must be more than 6 months. Okay, na? This is having the bilateral pedioderma. Weight for height is must be less than -3 g square. MAT, median sulfate will be less than 11.5 centimeter. Treatment with the IV fluids with the ringal active with the 5% dextrose. Okay, na? Remember this one, guys. SAN criteria. SAN is age more than 6 months. Bilateral pedioderma. Pedal edema. Weight for height is see, weight for height, not height for weight. Okay, now they will going to confuse you guys. Okay, now remember. Okay, guys, please remember this one. Acute versus see acute versus chronic malnutrition. So, guys, acute versus chronic malnutrition. We are going to use the mnemonic is the हवा लाल दुपट्टा उठ गया रे मेरे हवा के झोंकों से तुझको पिया ने देख लिया हाय रे see हवा हवा. Okay, now see guys, हवा. First of all, HA means low height for age. Low height per age is going to the chronic dwarfing or chronic nutrition. Chronic, chronic malnutrition. Chronic malnutrition. Hawa, Hawa, Ba. It is the low weight for age seen in the both acute plus chronic malnutrition. It's the both acute plus chronic malnutrition. Okay, both acute plus chronic malnutrition. Next one guys here. Next is the WH. Okay, na? WH. Weight. Next is the WH. This is the from this here, guys. You have to take the weight for height. Okay, na? Weight for height. You know, weight for height. You have to see the acute malnutrition or wasting. Okay, na? Guys, if you remember these two, they automatically it will going to mark the correct answer. Okay, na? So guys, they are the examples you have to remember. So I think you guys remember everything as you are remember. Please do not make any mistake in the CSR. Okay, now. So I think it's very clear. So here the episode 1. I will try to continue. Okay, now. Please stay with me. Thank you very much, guys. PDF in the link.